like to welcome everybody here today for the Medicare Basics program. We are really pleased you're here with us today. Appreciate all the folks that are helping us with the program and also our guests. We may have some other people joining us here in a minute, but just to give you a heads up, we are recording this program. If you prefer not to be seen on camera, you can always turn off your own video camera on your own device if you prefer that. And you're welcome to do either one as far as we're concerned. If you just have concerns about being recorded at all, we will upload this program later and just show it online on our YouTube channel on the library, through the library page. So that is another option also for you. As many of you know, in the past, we have done our Focus on Seniors programs in person. And of course, due to the pandemic, we are trying to be as safe and healthy as possible and do our programming online now. This is our first live Zoom program, so we appreciate your forbearance with us if we have some technical bumps and issues now and then. A couple of things I'll mention too is we will be muting everyone during the program, just to avoid the extraneous noises and things. However, there will be questions and answers. Yeah, hey, how are you? There will be questions and answers. So at some point you can be unmuted or to ask your question, or we'll be watching, kind of scanning for folks who raise their hands during the program to ask a question. Again, we do appreciate everyone being here. I appreciate my colleagues here who are helping me with this, and also, of course, Joani Shaver, who's the director of the Blount County Office on Aging. Many of you may know her already. She's helped us so much in the past. And she has also invited some area agents here to help us with questions and answers individually at the end of the program. So thanks so much to them. She'll introduce them individually in a bit. A couple things I would like to mention about resources that we have at the library real quick. Joani was kind enough to bring us the Medicare and You 2021 booklet. So we have a stack of those available for you to pick up. If you prefer not to come in the building, if you're concerned about health issues, we can even bring those out to you through our curbside service. And we are continuing to do curbside service here at the library for those who have concerns about health. And so that is an option. And we also have a database on our website called the Waste Ratings Medigap Report, which would help you evaluate the cost and efficiency of companies that provide supplemental insurance. And I put in our chat some information on how to access them on our website, or if you have questions, let us know anytime. We will, have information in the chat probably, and if at the end of the program you would like to have that sent to you, we will be happy to take your email address and send that information to you. So, well, those are the little housekeeping issues, I believe, and right now I would like to turn this over to Joani Shaver. Thank you so much for being here, Joani, and looking forward to your talk.
Thank you very much.
Joani.
Okay, I'm unmuted now.
Okay.
I just wanted to thank the library for hosting this event. Hopefully we will have some people joining us who can benefit from the information. It's always good every year to review the different parts of Medicare, the changes, and hopefully we can navigate the system to our advantage. That's always the hope. We have 3 independent insurance agents here with us that will be available afterwards to answer any questions you have individually. We have Wallace Gillespie and Danae Oglesby and David Toper. He's gone. Okay, there he is. And We thank them for participating and hope that you take advantage of their expertise at the end of this presentation. So I'm going to now begin by sharing my screen, and hopefully this will go as smooth as it did during practice. All right. I'm seeing it. Hopefully everyone else is too. This is our Zoom version of the presentation we normally do in October. I thought this kind of covered it all. And we're going to try and sort some of this out, and hopefully everyone will gain information from the info, the presentation today. So Medicare is basically health insurance. It's for those 65 and older. It's for those who are younger than 65 but have certain disabilities. If a person is receiving disability after the 24th month, they're eligible for Medicare. And so we have a number of people in Blount County who are younger than 65 and on Medicare. And those with end-stage renal disease are also eligible for Medicare, no matter what age. Original Medicare covers 80% of their approved costs. So the extra 20% of not only healthcare, but all of vision and hearing and any other non-approved expenses each year are expenses that each individual has to come up with a plan to cover. So just keep the 80% in mind. The Medicare and You handbook has definitions, detailed information on everything that we're going to discuss. So if you have it in front of you, all these gold page numbers, that's related to that book. So page 113 is all the definitions of the various terms. If you have any questions about anything we talk about, just bring it up to the individuals in the breakout rooms at the end. The best source of information is Medicare.gov. And it's important that when you go to Medicare.gov that you enter the exact website that's listed here, because there are a lot of fraudulent websites that they look similar to this, but they are not the official Medicare website. So this is the one you want to use. And this is the one that gets updated. Once a book is in print, it's frozen in time, but the website is constantly updated. And as prices change, as options change, as the rules change, that's the best source for information. So what's new in 2021? They're really trying to help the diabetics in our midst. There are some advantage plans and some drug plans that have lower out-of-pocket insulin costs. Now, if you have end-stage renal disease, there's advantage plan options. Medicare now covers acupuncture. It never did very well before. It has, because of COVID, really expanded the use of telehealth, which is great for elderly people who have trouble leaving home and going to a doctor's office. And also virtual services like check-ins for blood pressure or whatever, those can be done over the internet, and it saves a lot of risk for older people. The Medicare.gov website is a great place to shop and compare for plans, but it's also now a place to compare healthcare providers, hospitals, nursing homes. They're all rated in the Medicare.gov website, which is really an excellent way to shop. So when you first turn 65, you have 3 months before and 3 months after your birthday month. So there's 7 months total that you can enroll in Medicare. The coverage begins based on your enrollment date, and it's generally the first day of the following month you enroll. If you don't sign up for Medicare when you're first eligible, then you may pay a penalty for Part B as long as you receive benefits if you don't have some other coverage that Medicare considers credible. I once had a call from a lady who was 85 years old and had never signed up for Medicare. And at that point, she was too old to sign up because she could have never afforded it. So it's important if you have neighbors, friends, family members, make sure that you're on top of it when they turn 65, that they know what their options are. Medicare enrollment is covered in the Medicare and You book. If you're on Social Security and you turn 65, you're automatically enrolled. Or like I said before, if you've been disabled for 24 months, then you're automatically enrolled on the 25th month. You can sign up yourself at ssa.gov if you're in a group health plan or not collecting Social Security when you turn 65. And many people are not now because the minimum age, retirement age, is turned 66. So a lot of people are having to deal with this option now. And just know that all these individual questions we will be available to answer afterwards. So we're just going to move through this right now. Annual enrollment is October 15th to December 7th. The annual part means that every year you need to reevaluate your coverage, change what you don't like, or at least review to make sure that what you have you still are going to like next year. It's especially important for drug coverage because the drug plans are moving target, it seems like. And a drug that was no cost this year might be $10 next year, or it might be dropped from a formulary. So it's really important that drug plans especially get reviewed. And for Part C or Advantage plans, most of them come with a drug plan. So you're going to be reviewing not only your drug plan, but the entire health care that you're getting. If you are happy with, after you review the plan you're on and you're happy with it, you don't have to do anything. It'll automatically roll over to next year. But if you change plans, you can enroll yourself through Medicare.gov, or I really recommend that you have a professional review with you what your needs are. There are just so many variables that it's important to get a second opinion. So there's 2 versions of Medicare. There's original Medicare. That's covered on those pages, and it's Part A is hospital insurance, Part B is medical or doctors, and Part D is drugs. And then the option is to cover that extra 20% of cost with a supplement or a Medigap plan. I like to call them supplements. It makes more sense. Then there's also the Medicare Advantage route. That's Part C. And Part C will include automatically all the same coverages that original Medicare covers in Part A and B. They also may include extra benefits, and more of those are being added all the time. So it's looking better. And then most Medicare Advantage plans also cover Part D or drugs. Part A is hospital insurance. I just want to dive in a little bit with that. I mean, it includes inpatient hospital care, inpatient skilled care in a skilled nursing facility, which we refer to as SNFs. It includes hospice and home health and blood. And so with only Medicare, you're going to have a co-payment, co-insurance, and deductible, unless there's a way that you've covered that with another policy. Medicare Part A usually don't pay a premium for that because you've paid all the while you've been working, you've paid in for your Part A coverage. Buying Part A is an option, but it's really expensive. This year, $458 a month. But if you want to buy A, you also have to buy B. So you pay premiums on both Part A and Part B. But most people automatically get Part A because they paid through their taxes, their employment taxes while they worked. So the covered services in Part A are inpatient hospital care. There's what's called a benefit period. It begins the day of admission as an inpatient into a hospital or skilled nursing and ends when there's no inpatient hospital or skilled nursing care for 60 days in a row. So someone can go in, they have pneumonia, they get released after 5 days, and the pneumonia hasn't been cured, they're readmitted into the hospital. That's the same benefit period. So it's interesting and complicated. So Medicare usually covers 80% of inpatient hospital care. It's important to know whether you're an inpatient or an outpatient. Outpatient also can be called observation. They're keeping you under observation. That is not inpatient status, and that can really affect what Medicare covers. So it's important to know the hospital is required to notify you if you're in the hospital under observation. And that's covered on page 28 of your Medicare and You book. Skilled nursing care is for someone who, say, goes into the hospital with a broken hip, has a hip replacement, and then needs to be receive rehabilitation afterwards. They would go to a skilled nursing facility, and it has to be medically necessary, and it's covered for the first 20 days of a benefit period. And then there's co-insurance for the 21 to 100 days. And there's no coverage really after 100 days, unless there's some extenuating circumstance. This applies to each benefit period. So you could have more than one benefit period in a year if you were really unlucky. It's really critical to know that Medicare does not cover long-term care or custodial care in a nursing home. That is not covered, and there are a lot of people out there who think it is, and it's not. Hospice care, I can't recommend hospice highly enough. I happen to be married to an ex-hospice RN, so I know a little bit more about this care that's provided. It's for a terminally ill person as determined by a doctor. They have to initially have less than 6 months to live. It's comfort care, it's not a cure, so they wouldn't be giving chemotherapy if they were on hospice. It's usually provided at home or in a nursing home, and all the medical equipment that's required is provided and paid for through Medicare. So hospital beds and other equipment that is needed to provide the care is available. It also provides the family an incredible amount of support, which continues for a year after a person passes away, a patient passes away. The family continues to get that support, and that's really critical to a lot of people. If there are any questions about Medicare Part A, maybe you can write them in the chat, and we could just take 30 seconds to see if anyone has any questions. I can't see the chat, so Kathleen, do we have any questions? We're going to move on then to Medicare Part B, covered on those pages in your Medicare and You book. This is my Bible, that and Medicare.gov, so I urge you to use it. This is medical insurance that's necessary because of an injury, broken arm, or a mental health issue, especially during this horrible COVID pandemic. Outpatient and home health care and prevention services and the medical equipment that is needed. The deductible for next year hasn't been advertised yet, so it's $198 this year. And then you would pay 20% of Medicare approved amount, or your Medicare supplement would pay anything over that. Excuse me. Make sure the doctors that you use and the medical equipment providers that you use are enrolled in Medicare, because if they are not, then it is going to be a lot more expensive for Part B. There are no out-of-pocket limits for original Medicare. The supplement plans have limits. K&L have limits. But the Medicare Advantage plans have annual limits on out-of-pocket costs. So that's a great advantage. I guess that's why they call them Advantage plans. And there's more information on that in your book. So that's quick and dirty about Part B. Part B is pretty straightforward. There's no sniffs in Part B. What's not covered by Part A and B are eye exams related to glasses, cataracts and glaucoma, and all that are covered under medical under Part A, but routine eye exams are not covered by Medicare. They may be covered by an Advantage plan, but not original Medicare. Dental care and dentures, cosmetic surgery, all these on this list are not covered by original Medicare Part A and Part B, especially the ones that are not, they're not covered if a provider that you use doesn't accept Medicare as a payment. So that's important to find out. Part D is for drugs. You must have Part A and Part B to enroll in D. The prescription drug option is run by Medicare-approved private insurance companies, and it's for prescription drugs. You buy a separate Part D plan if you're in original Medicare, or many Advantage plans include Part D coverage. There's a penalty that applies for late enrollment in Part D, and many people that I talk to say, well, I don't need Part D, I don't take any prescription drugs. And my answer usually is, that's today, and tomorrow could be a disaster. So you need to prepare, you need to think down the road for Part D. And there are some zero cost plans that would be perfect for somebody who doesn't take any medications right now, but you just never know when something is going to hit. There are two ways to get Part D coverage. One is just buying a Medicare prescription drug plan and having original Medicare. The other is to buy a Medicare Advantage plan, and that includes drug coverage. And you may also, if you choose an Advantage plan without drug coverage, you'd also have to choose Part D. the key thing to remember is you have to live in the service area of the plan. So what's interesting is a lot of people around here spend part of the year somewhere else. That's where an advantage plan isn't necessarily the best choice, because if they had a medical emergency, if they had a need for medical care, not necessarily an emergency, and they lived outside of the service area, it could be complicated to get coverage, or there may not be coverage. The cost for Part D depends on many, many variables, but one of the key variables is whether the drug that a person is wanting covered is in the formulary of the plan that they're looking at. And Medicare.gov does a really good job of explaining, as you enter your drugs into Medicare.gov, it will pull up the plans that are best suited based on the drugs that you take. So that's a really big advantage of using Medicare.gov, and they keep up to date as changes happen. You should all by now have received a communication from the drug plan or the advantage plan that you're currently on for this year, announcing any changes for that plan for next year. And the biggest problem is people don't read the information. So make sure if you get something from your drug plan, you open it and read it. Don't put it in the stack of newspapers, because it's really important information that'll help guide your decision for 2021. So Part D is based on whatever plan you choose. They can be really expensive, or they could be zero cost, or they're part of an advantage plan. The premium, the deductible, the co-payments, and the co-insurance apply to drug plans. So many drug plans this year had a deductible of over $400. So if you have very inexpensive medications, but you take one expensive one, you may not want a drug plan with a deductible that's really high. But it's just totally an individual choice that you discuss with an expert who's guiding you on what your options are. There are different tiers of drugs, and drugs can go from one tier to another in even within a given year. And that really affects the cost that a person would pay if they were using that drug, had a prescription, and needed it filled monthly or every 90 days. If it goes from one tier to another, it's going to affect the price. Mostly either up or down, but a lot of times it's up. Then there's the old donut hole. So once you reach a certain expense, cost, out of pocket, and what the plan is paid, you go into the donut hole and all the rules change. And that's a really good discussion with one of these three experts, because I've studied it and I still don't understand the donut hole. I understand catastrophic coverage. Once you're out of the donut hole, then you don't pay anything. But when you're in the donut hole, it's a black hole to me. The actual cost you pay also is going to depend on the pharmacy you use. If you're in a pharmacy that's in the network for the plan you're on, then your costs are going to be lower. And so it's important to know how far you're willing to drive, whether that pharmacy is the one your fave is in the plan you're choosing. That's really important. Now, I'm going to touch later on extra help for prescription drugs, but just know that help is available. So we're going to skip the questions, I think, for now, and just keep moving. And you can write them in the chat. We can answer them at the end. So Part C, Advantage plans, those are the ones you see advertised on TV. Now, there are a few supplement ads that I've seen, so Medigap ads, but Most of the ads you see this time of year are for Advantage plans. It's an all-in-one health plan. It's managed by a private insurance company. They take this year, the $144.60 that you pay for Medicare, they take that premium and manage your care on top of maybe another premium that they charge for maybe the extra benefits that you would get. It includes, an Advantage plan is required to include everything from Part A and Part B of original Medicare. So it's kind of easy to, it's comforting to know that no matter what Advantage plan you choose, you're getting at least original Medicare Part A and B. And many of the plans now include Part D for drug coverage. Many of them are offering more benefits now. So they're offering dental, vision, silver sneakers is an example of wellness. And the disadvantage of an Advantage plan is usually you have to use a network of plan providers. So with original Medicare, you can go to any doctor you want and you don't need a referral for a specialist. That's the difference, the primary difference. So they have extra benefits and services, but they also limit where you can go to use the benefits of the Advantage plan. So anyone who has Parts A and B can join an Advantage plan. They have to live in the plan service area. So keep that in mind. If your sister in Florida has a really great Advantage plan, it may not and probably won't be available in Blount County. So you have to shop for the plans that are available in our area. And those will be included on Medicare.gov automatically because you're going to put in your zip code. Or when you talk to the local agents, they know what plans are available in our area. There's an HMO, a health maintenance, that's a network, a preferred provider. It's any provider, but it's more money to go to some than others. And then a special needs plan is for special groups of patients. And in your book, you'll see PFFS and MSA plans, but they are not available in our area. So you pay for a Medicare Advantage plan, you're going to pay your regular Medicare premium. You may pay an additional premium. There may be an additional deductible. Usually, I don't think there is, though, besides the deductible of regular Medicare. What you pay is going to depend on how many visits you have and how much you have to pay for each one in a year, the type of healthcare services you need, and how often you need them, especially whether services are in network or out of network, whether the doctor accepts Medicare approved reimbursements or is going to charge you for anything over and above what the Medicare doesn't pay, whether there's extra benefits that require extra payments, and the yearly limit on your out-of-pocket costs. Whether you have TennCare or are enrolled in a Medicare savings program, that definitely will affect the cost that you pay during the course of a year. So here are the questions I recommend that you ask. Ask, is there a monthly premium in addition to Part B? So Part B is what would come out of your Social Security check. Is there another premium besides that one for the Advantage plan you're considering? Is there an annual deductible? How much do I pay each time I go to the doctor or a specialist? What type of healthcare services do I need? And how often are they needed? Do I just need an annual physical? Do I go to 4 different doctors because I have issues that are chronic? That plays a lot into what plan would be the best for you. My favorite doctors that I've gone to for 62 years, do they accept full payment of the Medicare approved amount? And what is the out-of-pocket maximum for each plan? And finally, am I eligible for TennCare? Important things to know about Part C and actually original Medicare is you can appeal the decisions. You can check in advance to see if something is covered. Out-of-network services may not be covered or cost more. So you need to know whether that's the case before you proceed. Providers can join or leave plans at any time during the year. So your favorite doctor may move. And now you're in a practice with somebody who doesn't accept Medicare, is not a Medicare approved provider. It may include fitness and wellness benefits, which for some people, that's a really big plus, but for others, they wouldn't be caught dead in a gym. So keep that in mind. And also the yearly limit on out-of-pocket costs. That's important to know what it is upfront. So new in 2019 was the option to switch between January 1st and March 31st. You can go from one Advantage plan to another one. That never was the case before. And you can also leave an Advantage plan and return to original Medicare and a drug plan if things don't go as you thought they would with your doctors or your drug plans. You can switch back. You can't do anything if you're on original Medicare, but you can do it if you're on an Advantage plan and you want to change. So we're going to chat about these if there are any questions. So Medigap plans we're going to move to now. Those are sold by private companies. They pay some or all of remaining healthcare costs for Medicare covered services and supplies. The key thing to note is if Medicare doesn't cover something, your supplement won't either. So it's not like it's a secondary insurance that you can draw on. It's just making up part or all of that difference of the 20% that isn't covered by Medicare. You have to have Medicare Parts A and B to purchase a supplement, and it costs an additional premium every month. And the other key thing, we're used to group insurance, and this only covers one person. So Medicare supplements, Advantage plans, drug plans, they only cover one person. There's no family plan. So just keep that in mind as you're comparing costs, because each person has costs associated with their healthcare if they're on Medicare. It's easy to compare costs across companies with supplements because all of the coverage is exactly the same from one company to the next if you look at the same choices. All the different choices for supplements are laid out in the pages in gold there, and I like that you're comparing apples to apples. That's a really good feature. I wish everything was sold that way. So the first way to get your Medicare coverage would be original Medicare, which would include Parts A and B, a prescription drug plan, and if you want to cover the extra 20%, a Medicare supplement or Medigap policy. And they, like I said, provide identical coverage, but vary widely in price by company. Original Medicare, you can go to any healthcare provider that's enrolled in Medicare and accepting new patients. Except for a few instances, prescriptions are not covered for Parts A and B. You don't have to identify a primary care physician. You don't need to get a referral to see a specialist. But all of the doctors have to be enrolled in Medicare. And generally speaking, deductible, coinsurance, co-payments apply in addition to the monthly premium. And all those terms are in the back of the Medicare and You book, so you can look and study them so you know them and can repeat them back. The second way is to buy a Medicare Advantage plan, a Part C plan. It includes all A and B coverages, plus many times prescription drug coverage also. And those are laid out very well on those pages of your book. So some people have group health coverage, and they also are over 65 and still working, and they want to talk with the person who manages the benefits for their organization, whether that be a benefits coordinator, a human resources, or a union representative, to see what the best options are for them. That's really important, and check on that well in advance of your birthday so you know what the best choice is for you. Generally, retiree insurance, the Medicare will pay first, and retiree insurance is the secondary insurance. Medicare and a supplement, it may make sense for you if you want flexibility in choosing your doctors, you visit doctors frequently, you travel extensively within the US, or you have a second home. If you have a second home in Colorado, then Medicare and a supplement, original Medicare, might be better because you're not here all the time. If you have a chronic medical condition, Medicare, original Medicare and a supplement might be a better choice. And if you don't mind higher premiums to get lower out-of-pocket costs. So if you're kind of risk averse, you want a predictable expense, this may be a good choice for you. And there's a number of different companies to choose a supplement from. A Medicare Advantage plan might make sense if you're willing to change doctors, you don't have any special connection. You prefer to have insurance that you're used to. So it's one plan, one premium, one contact, one card. You pull up the number on the back of your card and you can get the answers you need. You visit doctors infrequently, rarely. You don't mind when you have to go to a doctor that you have a co-payment and co-insurance. You want lower premiums, higher cost sharing. You don't mind comparison shopping for plans. Sometimes it gets a little confusing. I have people come in my office and they're kind of blurry-eyed, and I just tell them to keep on trucking. They're almost there. And I congratulate them for doing the research because it'll really pay off. If you want options that original Medicare doesn't provide, like the eye exams, the dental, the hearing, that would be a good reason to choose an Advantage plan. If you want that out-of-pocket maximum, if you're a pessimist, you probably want an Advantage plan. See, I'm an optimist, so I'm blearily an optimist. And there's about 14 plans to choose from in our area of Advantage plans. So if you're unhappy, like we said, you can go to an Advantage plan. If you don't like it, you can switch during that window of January 1st to March 31st. And you can't switch from original Medicare to Advantage plan, but you can go back the other way. So there are special enrollment periods, SEPs, and they're detailed in your Medicare and U book. They include losing coverage from an employee plan. You either retire or you get laid off and you lose that coverage. You move. My sister-in-law moved from near Houston to near Shreveport in Texas, and she went to have surgery, and she could not, her plan was no longer valid, so she had to switch plans before she could move forward. If you have TennCare or if you lose TennCare, that would be a special enrollment period. If you qualify for extra help or you lose it, that would be another special enrollment period. And if you live in a nursing home or you're going into a nursing home, that would be another special enrollment period. Those are really the most common. So there's a test. The test is going to be on January 1st when you start this new coverage and you realize, whoa, I did really well, or, oh, this was a mistake. So just remember that if you end up in an Advantage plan that you don't like, you have until the end of March to go back or switch plans. Right now, we have no information. I don't know, maybe the agents know more than me, but right now, these are the costs based on last year. I haven't heard anything different yet. And once we have those new costs, we'll post them maybe in this PowerPoint so that people have the latest info. The 5 biggest mistakes are signing up too early for Medicare or too late, not understanding the difference between a Medicare, original Medicare and a supplement and a Medicare Advantage plan. Just guessing, just going down, okay, I'll take that one. That's not a good way to pick a plan. If you are low income, please call me because we can get you some extra help. And the other biggest mistake is not reading those documents that are sent to you in the fall, not reevaluating whether you should stay with what you have or move on to a new plan. So extra help is available. If income is less than $19,140 for one or $25,860 for two, we can help people apply for help with their prescription drugs and for help with Medicare premiums. And we have a program, and it's called Savings Checkup. We help people enroll in 5 benefits, but it's the 3 appropriate ones for here are TennCare and Medicare Savings Program and low income subsidy for prescriptions. We also help with energy assistance and food stamp applications. In the past 15, 16 months, we have brought in $1.6 million in benefits to Blount County seniors through this program. It's often a fight. They willingly take our tax dollars, but when we need them and we try to get them back, it's very often a struggle. We have a great staff and volunteers that are committed to helping seniors. So if you come across anyone, a neighbor or a relative who is struggling to make ends meet, send them to our program, and there'll be info at the end, the phone number. So these are good websites if you have medicines that you're paying more for them, maybe what your insurance will pay is still so expensive that you can't afford it. Oftentimes, these two websites are really great resources to make your medicines affordable, your prescriptions. So please, goodrx.com. All you have to do is do a search, an internet search for prescription assistance, and these two websites should come up. We have a state health insurance program that is funded by the government, and it provides free local counseling to Medicare recipients. And I'm part of the SHIP program, so I'm a volunteer with the SHIP program also. And we are totally independent. We're not going to recommend one policy over another. We're just going to give you the basic information that you need to make your own choice, because it's critical that you have the say and you know what you're looking for. They also are really helpful with appeals. So if you get a bill that you don't believe is accurate, the SHIP office is the place to get help, appealing costs and helping with complaints. The main difference between fraud and abuse is intent. Abuse is not quite as intentional as fraud. Billions of our tax dollars are wasted every year and go into the pockets of people who are abusing the system or absolutely fraudulent. So when you get your Medicare statements, or if you view them online, you're really encouraged to look and see that, yes, I did get that service, and yes, it was on this date, and make sure that somebody isn't stealing your information. Treat your Medicare card like a credit card, and make sure that no one else has access to it, because it's costing us just billions of dollars. So keep records of what services you're receiving, and then compare them to the statements. And EOB is an explanation of benefits that you'll get. Don't share your Medicare number. Don't give it to somebody else to use. That's horrible. And don't accept any free services in exchange for your Medicare or Social Security card over the phone. The fraud is right now really rampant because of COVID, and a lot of it has to do with Medicare. So these crooks are promoting cures for COVID or vaccines for COVID, and all you need to do is give them your Medicare number, and that ain't a good idea. So if somebody calls and offers you something free for your Medicare number, just hang up, please. Don't argue. So the Senior Medicare Patrol is in the same office in Knoxville with SHIP, but they provide different services. So they also you need to report fraud or errors or abuse to them too, because they can help you. Here's the best sources of information. Like I said, Medicare.gov, and this should say Medicare and You 2021. Sorry. There are those books at the library. I have them at my office, and I don't know if any of the agents have them, but it's a really good resource for the things that don't change. Medicare.gov is really a good place to compare policies. So we have experts, and if you don't want to participate in a breakout room, feel free to call me, and I'll hook you up with one of these 3 fine people that are here to help today.